Hi, I'm Dr. Mila Brujic, and welcome to 3-Minute Clinical Insights, where Dr. Kading and I will be discussing clinically relevant topics specifically related to improving patient care. Dr. Kading, today we're going to be talking about hydrogen peroxide-based systems.
That's right, Mila. You know, peroxide as a solution has been on the market for a very, very long time. In fact, ClearCare cleaning and disinfecting solution has been around for over a decade and has come to be known as the gold standard with regards to peroxide solutions.
Yeah, however, relatively recently there's been a lot of other peroxide solutions that have actually been introduced to the market. It's common for consumers to think that store brands are the exact same as their name brand counterparts. We certainly know that store brands have different formulations than their branded multi-purpose solution counterparts. But Dave, can you explain some of the concerns or even issues that we have with hydrogen peroxide-based systems in general? Absolutely.
One of the major things that we see as a problem is the residual peroxide that is left over after neutralization. We know that 100% of peroxide cannot be neutralized, and we have all had patients who have used a peroxide incorrectly, and we know what happens then. Typically, patients will become aware of residual peroxide at around 100 parts per million, but with ClearCare solution, we know that the neutralization process takes that down to around 60 parts per million or even less. And that's really in the same range as saline solution and less than what patients can feel. But with the other solutions, we don't really know how much residual peroxide is left over after the neutralization process. Beyond that immediate discomfort, if residual peroxide left in the lens gets too high, it can lead to uncomfortable lens wear. Each patient has a certain threshold, and if that residual peroxide is just above that threshold, it makes sense that the lens could lead to irritation later in the day. You know, one of the other benefits of the ClearCare solution is the surfactant that is in it.
That's right, Dave, and it actually contains something called Peroxide 17R4, which is proprietary to the ClearCare system. As you know, peroxide is good for cleaning and disinfecting, but often our contact lens patients need something more. That's really the benefit of this surfactant. Peroxide 17R4 works to clean and helps remove additional debris and protein from the surface of the lens. And yet, this has been shown over the past decade to be very gentle for our patients. Plus, the unique basket mount platinum disc helps optimize neutralization upon basket insertion and not before for a full balanced clean.
You know, that brings up a good point about using a solution that we've come to know and trust. And with ClearCare, we know that it's effective for our patients, but also we know that it has withstood the test of time. It's also preservative-free and PHMB-free. So it's an excellent choice for patients who need or prefer a preservative-free option for cleaning and disinfecting their lenses. I think that our takeaway message here is that we need to recommend ClearCare to our patients because there's just too many unknowns with the other peroxides. Thanks, Neil, for your input and your insights here. We always appreciate these types of discussions. And thank you so much for joining us for this month's 3-Minute Clinical Insights.